Spine surgery is typically recommended for patients who have ongoing neurologic symptoms, pain, numbness, progressive symptoms that have not responded well to more conservative treatments such as physical therapy, pain management treatments and steroid injections, appropriate medications, and very importantly, alteration of their activities if they just need to rest or take it easy for a while. Those measures a lot of times help the patients. When they have a surgical problem that's been identified and those more conservative measures are not helpful, then it's time to start thinking about surgery. For something like an anterior cervical discectomy, those patients typically go home the next day if they don't go home the day of surgery. For a more involved case, it may be typical that a 2 or 3 day recovery in the hospital is necessary, and a fair proportion of those patients with the more involved cases wind up being referred to an inpatient physical therapy facility. After a spine surgery, the response and hopefully improvement that the patients experience is variable. One of the concerning factors is someone who has had long-standing symptoms that typically predicts that even though they may improve, that improvement may take a significant amount of time. Someone with a more acute problem typically has a more rapid response to correction of that problem. The limitations on driving and returning to activities and work vary with the patient's progress and the type of procedure they've had, as well as, particularly for work, the type of work that they do. If they have a more sedentary job, of course they can return more quickly. For someone who does heavier type activities, that can be more limited. In general, somewhere between 6 to 12 weeks for a more involved procedure before the patients make what they would feel is a good recovery. Almost all spine surgery patients wind up being referred for physical therapy. The duration and the involvement of that therapy depends on the procedure they had, the condition in which they started, and their progress. For the patient who has a fear of spine surgery, I would say that with the appropriate patient selection and with the knowledge that their physicians and their team will put them through the paces to attempt to get them better with more conservative means, specifically under those circumstances, the response to a surgery where you are treating an identified problem is relatively promising. A large proportion of those patients do well given an appropriate rehab course and enough time to recover.